We've invited a special guest here today. Welcome, Ellen.
Hi, Michelle.
Hi,
Courtney.
Thanks for being here.
You're welcome. Glad to be here.
So to start, tell us a little bit about your work with suicide prevention and awareness.
Well, I've been working in mental health for about 30 years, so I think I was concerned about suicide prevention for at least that amount of years. But within the last 5 years, through the help of the New York State Office of Mental Health, I have had the opportunity to be involved with more trainings around suicide prevention, and I'm continuing to get training. In fact, tomorrow, through a cooperation with the Office of Mental Health and the Ulster County Mental Health Department, we're going to be doing training on youth suicide prevention and having that type of material available to the community also, because some of the training I've taken have had concentration more with working with adults, and we're going to have more training specific to youth in our community after tomorrow.
Wonderful.
Now, we've heard a lot about these products, Safe Talk and Assist. Can you tell us a little bit about those?
Yes, Safe Talk and Assist were developed by a company in Canada, and when the Office of Mental Health wanted to have more trainers available in New York State, they decided to contract with LivingWorks to bring those two products into New York State. So Safe Talk stands for Suicide Alert for Everyone, and it is a training, a 3-hour training that anybody in the community can take in order to become suicide alert. And Assist is a 2-day training which helps people to actually do an intervention, so anybody in the community can be taught how to respond to a person that we now know has thoughts of suicide, so that our job is to help people with thoughts of suicide, not to translate that into action where they would actually attempt suicide.
Wow, they sound like really great programs.
It is. It's been pretty effective. And I think the important thing is to let everybody know that it's trainings for any of us in the community, not specifically for people that are professionals or would be in the mental health field.
Yeah. What do you think the biggest myth around suicide is?
I think the biggest myth is that it couldn't happen to me, and it couldn't happen to somebody that I love. And I think what we need to understand is that having thoughts of suicide is part of the human condition. And each one of us can get into that space depending on what's happening in our lives. So you could be fine this year, and then come 2011, you could have several things happen to you. Like you could lose a job, you could have a death of someone that you love, your possessions might be at risk because you don't have income, and all of a sudden you start thinking, why am I here? All this is happening to me. And when you get into those kind of thoughts in situations, it's just normal for people to have the possibility of thinking about suicide. So our job really is to help people to recognize that that could happen to us, and that we want to really prevent those thoughts from going into actions. Yeah. And that's really the key, I think. So I kind of want to let people know that it's okay if that's that's happening to you, but if it is, you need to reach out for help. And the most important thing is to know you're not alone, and that there are people in the community that could help you so that your thoughts don't go into actions.
Thank you. What advice might you give someone who is concerned about a loved one and maybe feeling like their loved one is having thoughts of suicide?
Well, first of all, like I said, Safe Talk is about being suicide alert. So when you tell me that somebody has someone they're concerned about, they're already suicide alert. They have the beginnings of being suicide alert. They know something's going on with a person. They can see things, they can hear things, they can sense things, or they learn something about the person that they care about, things that are going on that are kind of putting their antennas up, and all of a sudden maybe suicide's involved. So we like to tell people we can teach you how to use that suicide alertness to help the person get help that they need, and to recognize when they're picking up these signals that they're actually invitations, that because in our culture we don't talk about suicide. I really would like people to realize that the key to preventing suicide is to talk openly and directly about it. So you have a person who's already caring enough about a person that they're picking up these things that are happening, and we want to let them know that those are invitations, because in our culture we don't talk about suicide. So no one's going to walk up to you and say, Michelle, you know me really well, I have all these terrible things happening to me, and it's now making me think about suicide. If that happened, we wouldn't have to be doing any of this type of work today, right?
Yeah.
That's not what happens. You know, people are afraid to tell people, they don't want to know, but at the same time, they really are trying to find ways to let you know. And we call those invitations.
Yeah.
Because when someone's sending you out an invitation, what do you want to do?
You want to respond.
You want to respond. We talk, you know, in the past we talked about warning signs. I think that makes it difficult for people because they get nervous and they get kind of close up a little. If people now realize that there's invitations, and if you love someone and care about someone, you're picking them up. That's, you know, you're picking up those invitations, and the person wants you to respond. They want you to have an opportunity to let you know that they're having difficulties right now, and in fact, those difficulties are leading them to think about suicide. So they want you to know. In fact, they're kind of, we like to say they're almost like begging people to ask them about it. But we want to make sure people are comfortable, now that they're picking up these signals, that they can talk about it with a person. So there's plenty of ways for anybody in the community to feel comfortable enough to pick up those signs and have a conversation. Because I think a difficult situation must be probably one of the worst, most difficult situation is if you had those signals and then something happened to somebody, and then you can say, oh my goodness, there was something that I was picking up. Now, I'm not here for anybody who's watching this program to say, oh, well, you mean I should have known something? Forget about what's going on in the past. Let's talk about the present and know that we're lucky enough in our community to have these trainings available for people so that now in the future, that when those situations happen, the person who has thoughts of suicide will get help, even for themselves. Because being suicide alert also means you're alert for yourself, and you know how to develop things that will keep you safe if you feel that way. So the important thing is not to worry that people have thoughts of suicide, but making sure that when you do, that you get help. So your thoughts. If you say to somebody, "Are you thinking about hurting yourself?" Because some people think that's the way to ask. Now, if they're thinking about dying, they can say, "No, I'm not thinking about hurting myself. I'm thinking about dying." So the important thing is to ask directly about really dying. Are you thinking about suicide? Are you thinking about killing yourself? Because that's the only way you'll know whether or not that's the situation that you're talking about. And it's very difficult. And it's part of the training that we do. And we actually give people chances to practice that because it's very difficult to say a statement. People say, oh, I can never say that. Or I'm going to be putting that idea in their head. So we have a lot of hesitation. The important thing is to know that a person is sending out those invitations because they want to be asked. And then once a person is asked, there are resources within our community where that person who has thoughts of suicide can get help. So it doesn't, again, go from thoughts to actions. That's where we want to help the person so they don't go into actions where they actually are hurting themselves or dying.
Wonderful. We so appreciate all of your efforts around this topic, and especially, you know...
And yours too. Thank you for giving me this opportunity.
Well, we hope that our program has shed some light on this topic, and your messages certainly help to reduce the stigma around this, and I think really echo the fact that all of us can be suicide alert and be suicide aware. It's oftentimes, you know, folks are expressing these feelings to their barbers, their waitresses, and the non-professionals in their life. So the more alert we can be, the safer community we will have.
Right. I think, you know, suicide prevention is everybody's business, and that being able to be suicide alert, you're saving lives, and it could be your own life too. And but it you know, more than likely you'll be saving somebody that you care about's life too. So, thank you.
Well, thank you for coming here today.
You're welcome.
Thank you.